Hello, my name is Dr. Rebecca Colleran from the Royal Victoria Hospital in Belfast. Today I'm presenting the results of a UK-wide national survey entitled General versus Regional Anaesthesia in the Management of Distal Radial Fractures. The primary aim of this study was to determine if clinical equipoise truly exists within the anaesthetic management of wrist fractures. To provide some context, distal radial fractures present a huge healthcare burden. In the United Kingdom, studies estimate wrist fractures occur in approximately 60 per 100,000 patients per year. In order to establish a national anaesthetic consensus on management, a UK-wide survey was conducted. The aim of this survey was to characterise current anaesthetic approach and to identify areas of agreement and variation among anaesthetists in the management of wrist fractures. As a result, an 8-question survey was disseminated through regional anaesthesia leads and via the RA UK newsletter. Participants were asked to identify their region of work, their current anaesthetic practice, and their opinion on the benefits of a randomised trial to compare general versus regional anaesthesia in this patient cohort. We received a fantastic response rate with a total of 355 respondents completing our survey. Looking at current practice, there is a clear split among anaesthetists. 65% of respondents utilised general anaesthesia, while 35% utilised regional anaesthesia. 89% do not believe there is sufficient evidence to support one technique over another. 77% of respondents believe that a multi-centred randomised trial would be worthwhile doing. And crucially, 72% expressed a willingness to randomise their own patients into a general anaesthesia or regional anaesthesia group in a future trial. Finally, when asked about the most important metric for these patients, 83% selected long-term functional recovery. In conclusion, the results of this survey would indicate that there is a genuine clinical equipoise regarding the anaesthetic management of distal radial fractures. Based on the responses obtained, a multi-centred randomised trial would be both beneficial and supported among the anaesthetic collective. The findings of this survey have also identified a key outcome metric, which will be beneficial for future comparison trials. Thank you very much for your time.